Those who rely on safer supply in BC have a message for Polievre.
I frankly find it disgusting, honestly, that we don't have more compassion as a society for these people that are, all of them are someone's child, someone's brother, sister, spouse, or neighbor.
Like, I mean, we could put oxygen on her if fire came.
It's the #1 cause of death in BC for those between the ages of 10 and 59.
Well, pretty much every time you go to the illicit market, you're risking your life because unless you have access to an actual drug testing equipment that's going to tell you the percentage of fentanyl in the product.
Fentanyl was detected in almost 90% of BC's illicit drug deaths. Prescribed safer supply was introduced in BC in March 2020 in an attempt to stop toxic drug deaths.
I've been fighting for safer access to drugs for decades.
But there's been criticism. For one, it's hard to get into the program. Out of thousands of opioid users, only 4 to 5% of people can get a prescription.
We've been saying, gotta have more access. So more doctors, more places you can get it, lower barriers, so that people can have an easier time. And then they should broaden the suite of pharmaceuticals that are available.
One BC medical director says the limited options mean some are reducing the pills to powder, to smoke or inject, which increases risk of overdose or infection.
And there's clearly resale of hydromorphone on the street. And the extent to which that is occurring, we really need to understand. Look, the price of a dilaudid 8 milligram tablet, otherwise known as a Dilly 8, on the street in the inner city of Vancouver has gone down from $10 a pill to $1 a pill. So clearly there is resale going on, and we need to get a handle on this.
Now BC's health leaders are reviewing the province's safer supply program based on data, they say, not divisive politics.
This safe supply program is very innovative and it requires to be evaluated. It may work very well for some individuals.
But clients and advocates say they want to be consulted.
They've shut the door to us. They've canceled meetings with various groups of drug users and people involved in this sector over the next few weeks.
The Ministry of Mental Health and Addiction say the meetings are on pause while it figures out next steps. Angela Sterritt, CBC News, Vancouver.